Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning in to my latest video. So for a patient who attended with deep, wet, impacted earwax on their eardrum, they've been using both sodium bicarbonate earwax drops and olive oil drops for several weeks. They've also been getting water in the ear, and they've also been using a cotton bud, a Q-tip. And you can just see on the right hand side there's a hair strand there. So that hair strand's obviously been pushed in using the Q-tip. Because the patient's been using a combination of drops, the consistency of this wax has become very mushy, and it is impacted directly on the eardrum. It's got a consistency of mashed potato. Typically, if you use hydrogen peroxide drops, if you've been watching my videos, hydrogen peroxide drops has a tendency of changing the consistency of wax into this mushy, horrible consistency really to remove wax, because it's very hard to suction. Ideally, when you perform suction, you want to get a suction grip, and then the plug of wax comes out in one solid mass. But in this case, that is not going to be what's going to happen. So we just have to persevere, be patient, and we are on the patient's eardrum. So we'd be really gentle, very delicate. The eardrum itself, it's wafer thin, it's less than 0.1 millimeters in thickness. We're just using a fine end gauge. So a fine end gauge is an extension attachment to the standard Zollner suction probe. Although it reduces suction power, it's a lot quieter than the standard Zollner suction probe, so it's more comfortable for the patient, and it's less traumatic. So if you do come in contact with the patient's eardrum, it's less likely to cause any significant or severe damage. And what we're trying to do here, we're just trying to kiss the surface of the eardrum. Now, the eardrum's got three membranes. The outermost membrane, the lateral membrane, is made up of the same skin that lines the inner two-thirds of the ear canal. So it's a very thin layer of skin. We call it a stratified squamous keratinous epithelial lining of skin. And it's 5 layers in thickness, but in terms of if you measure the thickness, it's less than 0.1 millimeters in thickness. The middle layer of the eardrum is made up of fibrous connective tissue, and the inner layer of the eardrum is made up of the mucosa, which is the skin that lines the middle ear. And sometimes it can get blurry in these kind of procedures because there is obviously the patient's been using a lot of drops, getting a lot of water in, so it was just getting a bit smeary there. So I decided just to come to the entrance just to mop up some of this dead keratin wax that's lining the ear canal, because that was obscuring the view slightly. And again, we're just gently hovering over the patient's ear canal. We don't want to make contact with the patient's ear canal if we can avoid it, because that would be uncomfortable. Now, the patient's symptoms were significantly improved already, but we just thought, well, let's just try to mop some of this dead skin that's on the canal. Can't get every bit out because some of it was tightly adhered, and it was also on the bony part. When we perform earwax removal, the idea is just to alleviate the patient with the symptoms. We're not there trying to mop up every little last speck of earwax. That's not good practice. Earwax, believe it or not, is good for you. It's healthy. It has 3 or 4 primary objectives. So earwax is slightly acidic. The acidity helps inhibit certain bacterial growth, and it also acts as an insect repellent. So I'll come back to the moment. So what I've done here, there's just some soft wax keratin in the anterior recess. So I've just bent the tip of the fine end ever so slightly so I can get access into this region. And I'm just hovering over this bit of soft wax keratin that's embedded on the eardrum. So I'll just go back to the benefits of earwax. So yeah, the acidity helps inhibit certain bacterial growth and also helps to repel insects. Earwax is greasy, it's oily, therefore it acts as a natural moisturiser, so it prevents the skin in the ear canal from drying and cracking. And wax is a sticky consistency, so any foreign particles, bodies, like dust, pollen, that enter the ear, they stick to the earwax. And as the skin that lines the ear canal and eardrum migrates outwards and out of the ear in a conveyor belt motion, any wax that's sitting on the surface of the dead skin, wax also is naturally expelled. So earwax also has a self-cleansing benefit. The patient's eardrum is slightly wrinkly, so that outer layer of skin, when you go for a shower or bath or you're exposed to a lot of steam, the fingertips of your skin go a bit wrinkly. And in the same way, the outer layer of the eardrum can also go a bit wrinkly. But we can see the eardrum there, the blue tinge. See the hammer bone. As I said before, we're not going to get every little last speck out. It's not the idea of earwax removal. By trying to be a bit clever and smart and trying to remove every little last speck, we can cause trauma to the patient's ear for no added benefit. Now, if there's a bit of wax in the canal wall, like here, which I feel safe removing, and I know I'm not going to cause any trauma, we will continue. But anything very deep in the ear, in the anterior recess or the depths of the ear canal near the eardrum, sometimes it's just best to leave. The patient's symptoms are alleviated. So just a bit of dead skin here, and I feel comfortable removing this. So we're just persevering. And the patient also attended with left unilateral tinnitus, no doubt because of the impaction. Immediately after the procedure, they reported not only their hearing to have significantly improved, but also their tinnitus to be alleviated. So a very happy patient. So it's just a bit of wax. Again, I felt comfortable doing this. When we train our clear wax delegates, we say to them, just feel, obviously, be safe rather than sorry. Obviously what we're doing here is a bit more complex. You need a really steady hand. You need a lot of experience doing this as well. And it's just a bit right there on the anterior part of the eardrum. And I felt completely safe doing that, hence why I decided to remove it with the patient. Just a bit of dead skin at the top of the ear canal. We're just going to gently remove this. You can see there's some residual bits around the edge, which is really in the corners, and we just leave that. That would be a bit uncomfortable for the patient. So I think we're just going to mop up near the entrance now. Bit of the wet, soggy wax. Patients had these symptoms the last couple of months. It's very hard for patients to see GPs at the moment, so they weren't sure initially what was causing their symptoms. So they were using drops for a couple of months almost before they went to the GP, who confirmed the presence of earwax, and immediately the patient contacted us and we managed to resolve it for him. So I hope you enjoyed that video, guys, and you're taking care of yourselves and keeping well and safe wherever you are in the world. I shall speak to you soon. Bye.